This is Okadowski of WeAreChange.org, and today we have the pleasure of being joined by Chris Martenson, Dr. Martenson. He has many accolades, too many to mention, but he is also a YouTuber, and he releases a lot of really good information on the Peak Prosperity channel. I would say very logical, very rational, above and beyond when it comes to looking at data and then having an honest intellectual discussion about that. And that's why he's getting the YouTube hammer and censored, just like we are and so many individuals out there. And this is why this conversation is going to be very important, because the people that are watching this video, the people that are seriously hungry for real information, they are the ones that are going to be playing a very important role in the breakdown of our society. They're the ones who are going to be picking up the pieces. And I think, Chris, you've been doing a great job. And I think it's very fair to say things are definitely not right, to say the least. They're not right when it comes to government that keeps rewarding the crazy, reckless financial system. They're not right with the mainstream media. And of course, they're also not right with the medical system. From your research, the first question that I had to you is, what are you seeing in the medical system that is not right to you?
So listen, we've got so much going on that's wrong in the medical system, especially here in the United States. But the first thing is, medical science is supposed to be based on data and reproducible data and things like that. So, I can just tell you, let's wrap it up in one quick thing. Fauci comes along with the NIH and the NIAID, and they're going to be looking for some sort of coronavirus treatment. Everybody wants a treatment. We've got no good treatments. And what should have been happening through the FDA, the CDC, the NIH, all of that, as well as any other government agencies, they ought to have been collecting massive data on clinical outcomes in patients with COVID so that they could say what works, what doesn't work. And I mean everything. Collect vials of blood from everybody. Use AI, big data. What are the vitamin D levels? How much selenium do they have in their blood? What are their hormone levels? And you look at all this stuff. And by the way, when they've done that in other countries, they've gotten really cool data, things you wouldn't have expected, like ivermectin. If people are on a standard antiparasitic, seem to be protected from the worst effects of COVID. People who are on Plaquenil, which is hydroxychloroquine, seem not to get infected as much or as badly, on and on and on. But in this country, all that research was pushed away. It was demonized. Instead, they went forward with remdesivir, which is this Gilead, very expensive, $1,000 a pop kind of a compound, right? Anthony Fauci pushes that, and they've set up this whole study, and they give this study kid glove treatment, right? They're going to give it to patients early because that's when antivirals ought to be given, early, not late, after the virus is already replicated, right? And they're going to, control for all sorts of variables, placebo, double blind. They gave it the full treatment, right? Well, they had endpoints on that, which were supposed to be how many people were dying and things like that. And halfway through the study, they pulled those primary endpoints, replaced them with a new primary endpoint, which they called shortened duration of stay in hospital. You don't do that in a study. If it's double blinded, the people who are looking at that data aren't supposed to see it. And that's not what happened. What happened was they thought they could see a little bit of early stuff coming out that might have showed that this was slightly better. It didn't have any change on mortality. It didn't change how many people died and how badly they died and all of that. And why did they do that? And why did that come out all of a sudden? Well, there was this Chinese study on remdesivir that came out in Lancet on that same morning that they came out with this emergency. We had to break the seal on this study early so we could get this exciting results to our people. So we could give them, standard of care treatment with remdesivir. Well, the Chinese study showed that it didn't shorten hospital stays. It didn't prevent viral loads from climbing in patients. It didn't change mortality. It did nothing. It was a bomb. So the best you could say was we have one study in Lancet that's a bomb, another one where we have early preliminary data that says it might do something. It's not based on science, but that's now standard of care. That is such a broken, illogical conclusion to make, but it really, in a nutshell, explains what's wrong with our medical system and the conflicts of interest that really push money, power, politics, prestige over actual medical science.
It's very interesting. One of the medications costs thousands of dollars, is very expensive, and is going to make a lot of people rich. The other one is pennies on the dollar. And again, that one doesn't get any attention at all. The discussion has been skewed here. The mainstream media definitely hasn't been doing their job with the proper conversation. There should have been a big conversation about the immune system, especially with how compromised how many people's health actually is in this country. And now what they're trying to push on is this contact tracing. I don't know if you're seeing this talk, but we're seeing this, quote, army in New York City being declared that they're going to be contact tracing everyone. Isn't it a little bit too late to be doing the contact tracing when we already have so many people impacted by this? And why are they pushing that? But again, the talks about other stuff like masks, that's not really being discussed at all.
You know, in my YouTube series months ago, I put out what I consider to be the gold standard for a pandemic approach, right? And this was really culled from seeing some countries are doing a great job at this, right? So you look at countries like Taiwan, just a spectacular job. Kuwait and Bahrain, just amazing jobs. Singapore, really good job, right? By good job, I mean they somehow managed to contain it and keep it all under check. And so what did they do? Well, the first thing you have to do is you have to halt the inbound infections. Number one, step one, that's it. Stop the infections from spreading around from communities, across borders, states, into countries, all of that, right? That's step one. So every country that did a good job at this immediately sealed their borders and said, hold on, we're going to be very careful about people who are coming in. Anybody who wants to come in, they're going to have to go through a 14-day quarantine period. They did that. Step two, everybody's got to wear a mask, right? And the reason is not to prevent you from getting sick so much as to prevent you from getting other people sick. Right? So if you are out there coughing, sneezing, or in this case, even talking, you are spewing virus particles if you have them in you. And this is the problem with COVID-19. It can spread during an asymptomatic period, meaning you have it, I have it, neither of us know that. We don't have fevers, we don't have chills, nothing's happening. We're fine, but we're spreading active infection. So the only way you can be certain that you're not going to spread the infection is if everybody wears a mask, not just like the CDC said, or even the WHO is like, oh, if you're coughing and sneezing, wear a mask. Dude, it's too late for this particular virus. That might be good advice for the flu, but this ain't the flu. That would have all been great. If you have those things going on, then contact tracing makes sense, because now you have a very small number of cases and you do want to nip those in the bud, right? Somebody has it, you've tested them, and nobody else has it in the whole community. So you found out they took one Uber ride, and you find the other person who took that Uber ride and sat in that same back seat. You notify them. Maybe they go to quarantine. Luke, that all makes sense. But by the time you're New York and you have possibly 1 million pre and post exposure people out there, contact tracing does no good, because you're basically going to contact trace the whole city. Like there's just no, it doesn't make sense after a certain point, right? It does once you've got your viral contagion down below a certain level, but we're nowhere near that. And in order to get there, we would actually have to do some basic hygiene stuff like you would see in Hong Kong, Singapore, Taiwan, Kuwait, Bahrain, all those other places. Everybody's wearing a mask, and they have teams of people out there disinfecting public surfaces, railings, banisters, doorknobs, any place that it's commonly touched, right? That's what they do. And by the way, we don't have to reinvent that wheel. That's how you get rid of these things.
Yeah, that's a great point. And it makes you really wonder what they're doing, spending so much money, hiring so many people when, again, they can't even get the basic stuff done here. I'm happy you brought the topic of masks up, because this is something that's been controversial for some people. I know some people that say masks are a sign of oppression, a sign of slavery. My response to that is, well, that's an interesting kind of interpretation of it. When I was in Hong Kong reporting on the protests there, masks were a sign of resistance against, the Chinese government and the state. And a lot of people are bringing up a lot of different points against masks. They're saying that you're going to get poisoned with CO2. They're saying that it's going to cause infection. And it really makes you wonder with so much kind of disinformation out there surrounding this particular topic, how do you kind of try to address it, and how do you try to get this word out there to combat some of the kind of larger disinformation? But how do you respond to someone coming to you saying there's CO2 poisoning and that masks cause infection?
There's nothing in the data to support either of those things, and masks are absolutely essential. And here's a couple things. First, to those people who think this is a sign of oppression, actually, I think going into an airport and having my face scanned for facial recognition technology is a sign of oppression. I think it's greater I like my anonymity, so maybe spin it that way. But here's the other part. First off, there's no way you're building up CO2 back there. There's no way this causes a breathing problem. If you are a person who has such a significant comorbidity that putting a slight barrier to air passage in front of your face is causing you difficulty, you really don't want to be catching COVID. So part one, we wear masks not because we're sick necessarily or we don't want to get sick, it's because we don't know who is sick, right? And so if everybody's wearing a mask, it stops the person who is sick from spewing those little virus particles out. That's part one. Part two, there was all this disinformation, the Surgeon General, the head of the CDC, all saying, oh no, people shouldn't wear masks because they might touch their face more.
We have provided guidance about using a medical mask in the community. And if you're not sick, you shouldn't be wearing a medical mask. But
wearing a mask actually protects you from getting the virus in you. And here's the most important part. Here's the thing. I don't know if we're all going to avoid being able to get COVID. We might not. But we know that the load of virus that you start with is a huge determinant in the course of the disease in you. Make it real simple. If you get a big viral load, like if you ate a big virus sandwich, you got a huge load, you're going to probably progress to severe, critical, or possibly even dead, right? We know this from all sorts of studies with animals and humans that the higher the load you get, it's called the inoculum. The higher that inoculum, the worse your disease progression. So if you start with a little tiny bit of this thing, though, just a couple of virus particles, then they have to replicate in your body and they have to build and they have to do all this stuff, right? So while that's happening, your body is learning how to fight this. Everybody gets better from this thing because your body eventually recognizes the virus and fights it off. The more time you can give your body to do that, the better you are. So if you start with a big virus load, you're starting 4 days in front of somebody who got a little tiny viral load in terms of the load in your body. So those are 4 days you don't have to fight this thing off. So if you're wearing a mask, you might still get sick. They're like, oh, they're not 100% effective. No, they're not. But at least you can be certain that if somebody coughs on that train and there's a giant virus particle floating through the air, that thing gets stopped. You might have a couple smaller ones sneak around the side, but you were starting with that lower viral load. So I'm wearing a mask because if I do get sick, it improves my chances of having a lesser course of that illness than if I wasn't wearing the mask. So we do it to protect other people. We do it to protect ourselves. And we especially do it if we have anybody we love at home that we care about. And a lot of people listening to this have parents at home, grandparents at home, people with comorbidities, obesity, hypertension, and past experience or current experience with cancer. If you have any one of those three things, those comorbidities are terrible for this. You have a much worse course of this. In diabetes, those four things. So how many people does that apply to? It's like half the country, right? So if you have that or you're living with somebody who has that, you don't want to get sick and bring that home, right? So you wear the mask for yourself, for those you love, and because if you do get sick, you don't want to start with a big inoculum because that is a bad deal. That's why we do it.
And plus, we're dealing with a situation that's still very uncertain. We still don't know exactly the long-term ramifications of this. We're getting a lot of conflicting data, a lot of things that don't add up, don't make sense, especially when you see how California was affected compared to New York, when you compare Germany to Italy. But when you look at the masks, I think masks are the perfect exemplification of how government reacted to this. They told us, don't wear masks, don't worry about it. Even here in the United States, they sold off their PPE and masks to China. China, of course, was telling everyone, don't worry about it, as they were gobbling up all the protective gear. And of course, now the government's like, okay, use the t-shirt. Meanwhile, the t-shirt particles, there's so many things I could get into. The t-shirts, they're so backwards, and they're not even the right fabric to have the most effectiveness. But now the government's like, well, why don't people wear masks? You wonder why? You were telling them not to for so long.